Isabel, welcome back to the office. It's good to see you again. So I have you booked for your yearly, just kind of overall skin assessment today, correct?
Yep.
Okay. So let's go ahead and jump in. I have quite a few things that I want to go over today to make sure that we have you all good for your yearly inspection. So I'm just going to have you relax. Are you comfortable the way that you're laying?
Yes.
Okay. So I might manipulate you slightly, just have you move kind of one way or another, but for now you're okay just the way you are. So I'm just going to start, of course, by placing on a pair of gloves. And I did see that you are allergic to latex, so these are nitrile gloves, and none of the tools that I will be using today contain natural latex in them, okay?
Okay.
Don't have to worry about that. And you are comfortable with our office cat, correct? She will kind of move in and out as she pleases, but it looks like she's comfortable for now. Alrighty, well, let's go ahead and get started. I am going to use a couple different kinds of light here to have a look at your skin. So you're welcome to close your eyes. The lights are a little bit bright, okay? Just having an overall look at your skin. Just want to make sure that there aren't any changes from the last time I saw you. Just looking at the areas that are most commonly in the sun. I will be manipulating your shirt just a little bit here and there just to get better visualization of the area. Just having a look at your hair. Excuse the helicopter noises. We've been getting a lot of life flights in this evening with all of the fires that are going on, so you will hear some airplanes and some helicopters. It's a busy night in the hospital. Of course, just having a look at your hair, I am going to look a little deeper into your scalp today. It does look like you have a new color in since the last time I saw you, so that is beautiful. And I'll have a look to just make sure that none of the cosmetic procedures you've had done to your hair have affected your scalp health. Just looking, of course, at your skin as a whole, looking for any changes in texture, any possible abnormalities. I know that you wear your sunscreen pretty diligently, so typically worry about sun damage with you, but you do spend a lot of time outside, so given that it's pretty cold this time of year, don't expect any of that to have changed. Just having a look at the eyelashes. Full and healthy. Okay. As well as at the eyebrows. And of course having a look at the clavicle area, looking for any changes or signs of swelling here. I'm going to go in with my other lights and just have a little bit of a closer look here. Excuse me while I just adjust my gloves slightly. This light is just going to allow me to visualize a little bit better. So what I'm going to do is move a little bit closer to you. So excuse me while I get a little more close. Okay. Just having a look at the skin on your forehead. Looking for any onset of abnormalities in skin texture, but really not seeing any. Also gonna have a look at the eyebrows. seeing any abnormality in texture here. Hair growth is thick and even throughout. Okay, so I'm gonna tickle a little bit. I'm just gonna have a look at your eyelashes, looking for any signs of possible microinfestations or abnormalities of the follicle in the lash, anything that could lead to signs of infection. Also having a closer look at your eyelid, and I'm just going to use the light to gently palpate the eyelid. Okay. So move down to the lower lid here and just having a look very gently underneath your eyes. This skin here is very, very thin. So just looking for any possible lesions or micro tears or abrasions in the skin. Skin does appear very well hydrated. Okay, so also having a look at the nose. Looking for any more obvious signs of congestion or excess buildup in the pores, but all of that looks okay. And of course, having a look at the cheeks, so this area appears to have the most sun exposure. It still appears intact. I'm not seeing any sunspots. You do have several freckles, but you've had those since you were a child, so I'm not particularly worried there. And of course, having a look at the lips. Lips are very full and appear healthy. No signs of abnormality in texture. Excuse me while I just palpate around. I'm not noticing anything abnormal here. Okay. I'm going to move along to your hairline and having a look directly at the scalp. Just looking for any more obvious signs of either infection or any possible infestation. Any damage to the scalp that may have occurred, possibly at the hair salon. So far, hair integrity appears to be intact. Of course, just having a look along the hair shaft itself. No signs of excess damage. Is your hair naturally straight? Okay. Doesn't look like you use a lot of heat on your hair, which is a good thing. And your hair is very full. So I'm going to do a slight tugging test. This is just going to test the strength and integrity of the hair follicle. So I'm going to very gently tug on your hair. It shouldn't hurt. Good, okay. Just making sure there are no weak points, especially among the hairline, where we tend to see signs of what's called traction alopecia, where there's abnormal pressure put on the follicles in the front of the hair, but I'm not noticing any of that here, so all of that is good. So I'm going to just a brief look at this ear since it's within my line of sight. Just looking for any abnormalities in the ear itself. Also in the lobe, I'll have you turn your head slightly. Very good. Okay, just having a look here. Any abnormalities? All of that looks normal. Okay. So I'm just going to come a little closer and use my light here to have a look at your neck and chest. Just looking for any abnormalities in the skin. Again, any of those extra sunspots. You do have freckles on your chest, but that is normal. I see a slight, very, very minor mole here. It does appear to be normal in color and shape. It is symmetrical. I'm not noticing a severely raised texture. It is slightly raised off the skin, but nothing that I would say is concerning. It is a normal pinkish tan color, which is good. Okay. Having a look everywhere else. I want you to continue to make sure that you use sun protection even in these colder months. And you want to make sure that you're bringing all of the product down to your neck and chest, which I'm sure you're aware of, but it doesn't hurt to remind you. Okay. So I'm not noticing anything abnormal upon visual inspection. So now I'm going to do some manual palpations. So I'll be palpating around your face, head, neck, and chest with my hands, okay? Let me know if any of this causes you any pain or discomfort. So I'm going to start by having you lift your head here just so I can gather all of your hair. Okay, go ahead and relax. Is that comfortable for you? Perfect. So I'm going to do some palpations of your head. Just feeling for any abnormal lumps, bumps, lesions, any open areas. And I want you to let me know if any of this is uncomfortable, okay? Just looking for any abnormal signs of swelling, or what we call edema. Any possible pockets of fluid. Don't appear to be feeling any of that. Just run my fingers kind of laterally, see if I feel anything abnormal. Along your hairline, as well as behind the ears, and in front. Any pain or discomfort here? I'm just going to feel along your face. So very, very gently feeling along the eyelid. So I'm just going to test for any bilateral edema here, feeling both sides consecutively so I can compare, see if there's any difference one side to the other. Go ahead and test. Palpate around here, feel for any abnormalities in your lymph nodes. I'm looking for any signs of swelling or possible inflammation in the glands. Could be an indicator of any ongoing infection. So you're going to feel me palpate around, just kind of gently seeing if I'm able to feel any of those individual lymph nodes. So far, not feeling anything. Just feeling along your neck and then along your clavicle. Also feeling for any abnormalities along your chest wall. of that appears to be seemingly normal. I'm just going to feel it right here below your neck. Good. Okay, very good. So far, nothing abnormal to note, so I'm going to go ahead and have a listen to your heart with my stethoscope. And I apologize, this is pretty cold, okay? So just breathe normally. I'm just going to be placing this in various areas. I'm going to start here, just above your collarbone. Okay. So far, everything sounds normal. I'm hearing adequate blood flow. There's no signs or symptoms of occlusion. Everything is sounding the way that it's supposed to be. Your heart rate is within normal limits. Not hearing anything that would indicate an arrhythmia or an abnormal heart rate or rhythm. Okay, so I'm just going to reach around the other side here. Very good. I'm just going to reach a little bit lower down into your top. Excuse my reach here. Very good. Very good. Okay. Okay. So I'm going to go on top of your shirt, just underneath your breast. Just take a deep breath for me. Good. Again. Good. One more. Perfect. Okay. So definitely no abnormalities there. All of that was normal. So that's good news. Your heart is healthy. Okay. Alright, so let's go ahead and move on to a different portion of the examination. And what I'm going to do now is use a couple different kinds of combs just to visualize your scalp and have a better look inside your scalp, okay? So you just relax in whatever position is comfortable for you. And let me know if at any point I accidentally pull your hair, okay? This comb is just going to give me slightly better visualization of the hair, as well as your scalp, and it's a good indication of the excess fallout. So we did have one hair that is loose and dislodged upon manual manipulation, but that's okay. I'm going to separate an area here. Very good. Okay. All of this so far is looking great. I'm not seeing any cause for concern. Okay, so hair is in good condition. Shaft is intact. Follicle is not attached, which is good. Okay, very good. Okay, so I'm going to use a different kind of brush here. So I just have this little wiry brush. I'm just going to be using this to manipulate certain areas. It just helps me get a better understanding of your scalp health. So looking for any signs of dandruff or flaking. Seems that there could be an infection or anything wrong with your scalp. It does appear very healthy. Hair is not overly greasy or over dry. It does appear well nourished, and I am seeing those natural oils, but it doesn't appear to be anything abnormal. Color is normal for your age. I don't see any grays or any signs of abnormal aging. Good. Okay. Alright, Isabel, so what I'm going to do next is check for any abnormalities in your sensitivity or sensory components of your scalp. So I have a couple of different things that I'll be using here. And I just want you to indicate by gently shaking your head if you're able to feel all of this normally, okay? Good. I'm going to move on to a different tool, testing the same thing. This time I'm going to use something more distinct. So this is very sharp, but it shouldn't hurt. Same thing, just indicate with a gentle movement if you can feel it. Okay. Good. Okay, very good. So no abnormalities with that. So we're going to move on to something that is slightly different. I have various brushing tools here that are all graded differently. They have different textures. They're all very soft. I'm just going to be brushing these along your face and chest. And just kind of relax. I'm just looking for a normal reaction in your muscles, okay? So the muscles underneath your skin will react accordingly if they are intact. So I'm going to start with this. Might be kind of ticklish, I do apologize. Good, so going directly over the eyelid, good. For that normal movement in the muscles, which I am seeing. Here, as well as here. Very good. Here, very good. Good, perfect. Good. And then here. Good, okay. I'm going to do that again, and this time I'm going to use something that is similar but slightly different, just a little bit less obvious. So we're kind of seeing the same areas here, so looking for a normal reaction here. Intact. Perfect. Good. Good. Perfect. Perfect. reactivity. That's exactly what we want to see. Perfect. Okay, great. So now we are going to move on to testing two different points. So I have two identical tools here. I'm going to perform the same test, except I'm going to use it bilaterally to manipulate two sides of your face at a time, okay? So just keep your eyes closed and we're going to do the same thing, testing for equal reaction on both sides of your face. So I'm going to start at the hairline. Perfect. Good. Okay. Perfect. Okay. Very good. So the next thing we're going to test is the most difficult. So this is a very, very minor sensation and should produce a very minor reaction. So we're just looking for an adequate response here. So we're going to test along the hairline once again, just very gently manipulating individual hairs. Good. So using a combination of strokes and gentle taps. Good. This allows me to be very precise. Just looking for that normal reactivity. Perfect. Okay. So just want to come a little closer so I can see these kind of micro reactions in the face. Very good. Okay. So it's gonna test you on the neck. As well as on the chest, just thinking for any abnormalities here. All of that seems to be within normal limits. So I'm just going to delicately here kind of pull this down just slightly and make sure we're getting perimeter. Very good. Okay, so all of that is seemingly intact. So what I'm going to do next is essentially the same thing, but I'm testing for cold response. So you have two cold globes here. And it shouldn't be uncomfortable, but it is very distinctly cold, so you should feel it, okay? I'm going to start by testing a medial point here. Good. Good. Okay. Now we're going to test for that bilateral sensation response here. Should be the same as we come all the way down in our So the last thing you want to do as far as the sensory component is just test this wider surface area. So this is a silicone brush. I'm just doing the same thing, just move this around different parts of your face, testing different areas for sensitivity level, okay? Good. And then even with your top on, you should be able to feel that all of this is about the same as it is on this side. Good. So let's go ahead and move on to the final portion of the examination, which is going to be some manual palpation and percussion. So I have a couple of reflex hammers here that I'll be using to test some different pressure points on your face. So you're just going to feel some light tapping, okay? Good. Okay. So go ahead and open your mouth for me. Perfect. Good. Just listening for that very distinct difference here versus here. Okay, so all of that sounds normal. So I'm going to move on to just do some temperature checks, looking for any variation in temperature. So I have a thermometer here, and I'm just going to be using this to check for any variation in temperature from one side to the other. So far everything is within 2 degrees, which is what we want to see. Very slight variance there, but it's equal to the other side, so that's fine. you. So all of that is seemingly equal from one side to the other with an average temperature of about 97.1, which is good. So the next thing I'm going to do is just test further for temperature variance with my hands. So with the backs of my hands, I'm just going to gently touch the outside of your skin here, just looking for any obvious variations. It is slightly warmer in this area, but it is equal from one side to the other. And just moving down. So thyroid area is normal in temperature. I'm not feeling any heat spots or any signs of isolated heat. Clavicle is slightly colder, but your chest is exposed, so that is normal. And chest wall is equal bilaterally. I'm not noticing any abnormal temperature variations one side to the other. Slightly colder here, but again, you are exposed to the air in this area, whereas the areas that are covered are slightly warmer. So that's all normal. Isabella, it looks like this here your skin examination is completely normal. I didn't notice any abnormalities. I didn't notice any variations in your skin. Everything looks pretty similar to what it did this time last year, which is good news. So I would like you to go ahead and come in again this time next year, and we'll get you scheduled for that up at the front desk with Serena if you would like before you leave. Of course, before then, if anything should come up, you're welcome to schedule an earlier appointment and we can have you in, okay?
Okay.
All right, well, thank you so much. It was nice to see you, and I will see you next year.
All right, thank
you.
you.
All right, you're welcome.